It is yet another beautiful evening. Yes, I believe you had a fine day, and just in case your day wasn't fine, or maybe you lost a loved one, we pray that God may comfort you. And of course, you people gotten, who have reached any certain victories, please endeavor to thank the Lord who has enabled you. But this is a Friday, and at exactly 7 p.m., of course, it is Health Port. Health Port is a program brought to you by Makerere University School of Public Health together with Family TV. Edwin Austin Mkalazi is my name. Yes, just in case you missed last week's episode, we looked at developmental delays. We were with Dr. Hanifa Namala Sengendo. She's a public health expert and a pediatrician. Yes, we are back with her. Doctor.
Yes.
Doctor.
Yes, please.
You are most welcome once again.
Thank you.
Kindly greet our viewers.
Dear viewers of our beloved Family Church of Uganda, Family TV, thank you very much for taking time off to be able to know about your health, the health of your children, and to the mothers and parents there. This is a great opportunity where we actually come and speak to you at a time when you can listen, the child is not sick. So you get these things when you are away from maybe a hospital setting. So thank you very much. That is a public health perspective. And you see, we try to use a language where everybody can understand.
Yes.
So that is actually why Family TV came up with such an important health port program.
Yeah, we are grateful. Maybe before we go ahead, I would like, because parents out there have questions. Yes, you have the Stepping Stone platform where you do more of children empowerment. Do you have any programs for mothers, as in for parenting?
Okay, yes, because you know what, Edwin, you cannot mentor or groom a child without looking at the parent. So at the Stepping Stone, much as our initial focus is at the adolescents and young people, we also have positive parenting. Why? Because unless if the parent, for example, unless if you, Edwin, you understand about your role as a parent, you cannot groom this young child. For example, we are here learning about early childhood development.
Yes.
Unless you as a parent, you know, you can then be able to mentor and talk to your children. Because even if my niche is adolescents and young people, I get them after they have gone through a very critical stage, early childhood development. So for us focusing at that age of early childhood development and telling our mothers and fathers also, by the way, not only mothers but also you fathers, it is very, very important. So yes, we do positive parenting for parents, and also we do mentoring for adolescents and young people.
Okay.
As they prepare to become mothers and fathers anyway.
Because parents would really want to listen to these good words more and more, even out of health port. But of course, Doctor, last week we talked about the developmental delays, and just to give our viewers a recap of especially of the causes, because you at least enlightened these delays, but to remind them about the causes, because they're very important. It's very important that a mother knows what causes what.
Okay. Thank you very much. Like we mentioned, the causes begin before the person actually gets pregnant. Some causes can happen during pregnancy, during birth, and during the early postnatal time, and during the early childhood development years. So before pregnancy, for example, if you have a mother who has an illness, for example, a mother has sickle cell, a mother has other congenital problems, the child can be delivered with signs and symptoms that shows developmental delay. Before pregnancy, if a mother is malnourished, if the mother is poorly nourished, that mother will get pregnant, will have a baby who will also be malnourished. And that malnutrition can actually lead to damage of the brain, depending on the particular type of malnutrition. So if before pregnancy the mother has such things, then they can lead to a child having developmental delays. During pregnancy, still, if the mother has maternal malnutrition, what we call maternal malnutrition, the mother is pregnant and does not feed well. So don't just say that you mothers who are pregnant, you just want to eat. They need to feed well.
Sometimes they say the appetite is high.
Yes, the appetite is high. That is good, but they should be feeding well. Because if the mother does not feed well, she can get what we call maternal malnutrition. And the baby will not grow well. Maternal malnutrition leads to fetal malnutrition. Fetal malnutrition means the baby, while still inside, also is malnourished. Okay? So that type of baby who is malnourished can actually get developmental delays. If the mother also has other familial diseases, like congenital illnesses, the child can have developmental delays. If the mother does not attend antenatal, why is it important? Because during antenatal, they can identify, for example, if the mother has a problem, and that problem can be worked on. If the mother does not attend antenatal, the mother will not be given preventive medicines, because some causes of diseases that cause developmental delay is, for example, malaria. During antenatal, we give these mothers medicines that prevent malaria. So if the mother does not attend antenatal, she can get malaria, and the baby can also get malaria, but that malaria can be so bad that it affects the brain of the baby. If the mother during birth, for example, gets difficult, during birth, normal birth, it's like a baby is passing through a channel, so the baby's brain is being pressed a bit, there is some bit of pressing of the brain, which is normal. But if the mother's bones are too tight, like these adolescent mothers, the bones, the pelvic bones, the bones where the baby passes are too tight, so they overpress the brain of the baby. This baby can eventually get developmental delay. Why? Because the bones have overpressed the baby's brain, and the brain gets dysfunctional. So this type of child whose mother delivered like that without any guidance, the baby can get developmental delays. That's why it is important when they go for antenatal, they can identify whether you can deliver normally or you need to get cesarean section. Immediately after birth or during the time of birth, if you just deliver from any place and they don't do maneuvers, you remember we talked about essential newborn care. You remember?
Yes, I remember.
Essential, now you are becoming a paradox, I think, Yes. Essential newborn care, where the baby is kept warm, the baby has to breathe within the first minute, the cord has to be cut and, and fixed, The baby has to be wrapped very well. The baby has to be put on the breast. These components of essential newborn care, if they do not happen, the baby can get a brain dysfunction. Okay? So essential newborn care soon after birth is very, very critical. But if the baby also during the early postnatal days, during the first 6 days, like 1 week, the baby should continue with the essential newborn care practices, until the baby goes through the times of immunization and all that. So all this time, below 2 years, the brain is growing a lot. And I told you, Adrian, that the brain has different parts.
Yes.
The parts that work on the muscles, the parts that help in, cognition, in understanding and thinking and comprehending, and other parts of the brain that help us to speak and all those things. So all these are causes. If a child below 2 years, for example, gets cerebral malaria, what you called omusujja gw'okubwongo, omusujja gw'okubwongo can be cerebral malaria, malaria that has reached the brain. So when that malaria reaches the brain, you find actually children fitting. I think in Uganda they call it a yabwe. Omwana bwafuna a yabwe, a child who gets a yabwe, don't take it unserious. Don't just continue taking these local things. That child should be taken to hospital. Why? Because that air that has come from malaria can actually go and damage the child's brain. And that child can get developmental delay. If a child gets infections and other things, these days infections have become so common and whatever. Some of them are not really very correct, but if a child gets diseases that need to be treated and they are not treated, then that child might get developmental delays. Yes. Okay.
And then, doctor, you've told us all this, but there is one thing that parents always attach all this to, and that is the background, the family background, the historical background. Is it very possible that some of these delays are genetic?
Yes, yeah, everything. By the way, for us doctors, we have a diagnosis called idiopathic. Idiopathic, it means the doctor is an idiot. In a way that the doctor doesn't know what the cause is. Some of these things are idiopathic. I mean, you cannot trace why the child has a developmental delay. However, some of these delays can happen in families. You find families and they are saying, yeah, even the father took long, like Adrian. Father Adrian, Daddy Adrian took long to talk. Maybe Adrian also stammers. Adrian took long to sit, because we said all these are delay, are symptoms of, developmental delays. So it can run into families. But if it is getting too much and it is a combination, for example, the child does not have neck control, you cannot say that even their grandfather was not controlling their head. If the neck is stiff, you cannot say their father also has a stiff neck. Those are going to extremes. So there could be those family predispositions, those family issues. But in a nutshell, it is a combination. If a child has more than one symptom and it is going beyond their age, then get worried and seek medical advice.
Yes, at that point, doctor, I think let's shortly go for a commercial break, and then when we come back, we shall begin from there. We are looking at developmental delays.
Brethren, yes, we can. We can clear the debt of church house. And I want to invite you to give generously to the love gift. May God bless you as you give.
Welcome back from the commercial break. Yes, this is Health Pot, and this program is brought to you by Makerere Universal School of Public Health, together with Church of Uganda Family TV. This program is basically looking at early childhood development and maternal health. Today we are with Dr. Hanifa Namala Sengero. She's a pediatrician and a public health expert from the Stepping Stone platform. She's taking us through the various developmental delays, what causes them, and we are now going to a very important segment in this whole thing that you shouldn't miss. Edwin Austin Mukalazi is my name. Doctor,
Yes, please.
we are back from the commercial break, and we've looked at all these delays. But is there hope that if my child is subjected to any of these delays, they can get well?
Well, it is very subjective. You know, things that happen at a critical time, some of them are irreversible. For example, if a child ends up with cerebral palsy, which I told you is a combination of symptoms,
Yes.
it is irreversible. It is like that damage has happened. That's why I told you, every child should breathe within 1 minute. Every child, the brain should get oxygen within the first 1 minute.
Should be awakened.
The brain should be awakened. Otherwise, you'll find that when that damage happens, it is irreversible. So that is it. What happens is that because the damage is irreversible, all these symptoms continue. But you know, when children go to the clinics, because they are clinics, for example, of cerebral palsy, they can improve, they can help them to speak a bit, they can help them in giving them walking aids, you know. They can help in many other things, but the damage is permanent. I think what is more critical is also to ask, what should mothers, what should we do?
Exactly. As parents.
As
I'm also a
parents,
parent. As
yes.
parents, what should we do?
What should we do? You are a parent, maybe by proxy, because you might be a brother
I'm a
to a
parent.
person who is pregnant or is planning to be
I'm
pregnant.
a parent by faith.
By faith, yes, you're a parent by faith.
Yes.
I think let us begin with first things first.
Yes.
Dear parents, let us plan for pregnancy. Because we said that these things happen even before one gets pregnant. For example, plan for pregnancy. You can go and do what we call normal checks or ordinary checks.
Before
Routines, yes, before pregnancy, because they can find out, for example, if you have little blood. Then the doctor, the midwife or the doctor can advise you that, can you first take some blood tablets before you get pregnant? Okay? And that helps you, because then your child will not have anemia, will not have little blood when they are in the womb. So let's plan for pregnancy.
And you as a mother will not become anemic.
You will
in the
not
course of
become
pregnancy.
anemic, because they can also identify if you are malnourished even before you get pregnant, and they advise you on how to improve your nutrition. But having begun from there, pre-pregnancy time, during the time of pregnancy, my dear mothers and parents, let's not say that these are things of long ago. We have to attend antenatal. Attending antenatal at least 4 times is very critical. Why? Because they can identify any risks that can happen to your baby that can lead to brain dysfunction. So every time you attend antenatal, please also give correct information, because the midwife there, the nurse can ask you questions. In your family, do you have this disease? And you just say no. In your family, does this happen? Or do you have this type of problem? Do you have high blood pressure in your family? All those questions are geared towards understanding whether you may have a risk that can actually affect your baby and your baby's brain and other things, and you end up with these things of developmental delay. So attend antenatal. And after you have attended antenatal, let's prepare for birth. Have you heard of birth preparedness?
Yes.
We should prepare for birth, because I told you essential newborn care. Part of that comes out of birth preparedness. if you are a type of mother who goes to hospital to deliver and you do not have simple things, for example, you do not have gloves to help you deliver, you do not have the mama kit, you don't have warm sheets. Remember essential newborn care, keeping the baby warm. Those are simple things, but they are very important. You know, preparation for birth means you prepare to give birth and you have these things that are required, that the baby will need within the first minute. The baby has to be wrapped. You know, the baby's cord has to be cut. So you need to prepare for birth, have your mama kit that has all these things, okay? Birth preparedness. The other thing is that try as much as possible to deliver in the hands of a skilled health worker. These things of saying, Banange, this is the person who delivered me, who delivered my mom, ono yazalisa mama wange. Those things with the exposure. She has helped very many mothers, but you are different. You need you yourself to be assessed, to know whether how you should deliver. And all the time, please, let's try to deliver under the hands of a skilled birth attendant. That is the hospital near you, whether it is public or private. Let me tell you, you will regret if a problem happened at the time of birth because someone could not resuscitate your baby. Resuscitating your baby means that, for example, someone cannot help your baby to breathe. You remember we talked about helping the baby to breathe. Someone cannot maneuver, has not been trained to help your baby to start breathing within the first minute, you know?
They'll just slap them.
They just slap them, you know? Those are all gone things. You should deliver within the hands of a skilled birth attendant. The other thing is to actually follow instructions of the health workers. They tell you that after you have delivered, please stay in hospital for at least 24 hours. Why?
For monitoring.
For monitoring. It helps for the health worker to check if your baby has things that may cause developmental delay. During that time, they examine the baby. Does the baby have enough blood? Does the baby have any congenital abnormality? Does the baby have an abnormality, for example, in the mouth? Is the baby able to suck well? Is the baby able to breathe well? You know, is the baby's cord looking fine? All these things, because infections during early days can go through, the infections can go through the umbilical cord and they cause damage to the baby's brain. So stay in hospital within the first 24 hours. And come back, when they tell you come back within 6 days, come back, because when you go back to the health facility, they will still examine you and they examine the baby. In case there is anything, for example, if they find that the cord is infected, the cord is rotten, they will be able to give you medicines and then this infection will not reach the brain of the baby. Okay? So go back. Then they tell you to continue with your immunization at 6 weeks, at 6 months, and as the immunization chart runs. So, and of course, what is very critical, apart from this, is for us to be observant. Like the Church of Uganda Family TV has come up with a program. It is on YouTube. You go and look for these programs and understand what should my baby be doing at 2 months? Because we discussed this during the previous health port programs.
Yes.
As a mother, you go and look for these YouTube recordings and get to know and write. The other thing that I actually want to tell parents is that get a baby's diary. There is what they call a baby's diary. It doesn't have to be a sophisticated book. You just get with a lot of decoration. You can draw your own pictures, you know. So you can get your diary and see, is my baby at 2 months? Is my baby able to move the hands? Is my baby able to open the eyes and look at me? When did my baby start maybe cooing? When did my baby start moving hands? If you see the baby is having abnormalities, Then you also note that at 3 months, I'm noting my baby's hands are always together. I'm noting my baby cannot even produce a sound. I'm noting that my baby is the saliva is drooling. So having a baby diary is very important. Ministry of Health has what they call a mother-baby passport. A mother-baby passport is intended to actually examine you and the baby to find if there are any issues. So go to the hospital, they give you a mother-baby passport. But you can also create yours by trying to understand what the milestone is at a particular age. We have these phones. Instead of just, listening to music or, seeing WhatsApp messages and whatever, you can Google what is the normal development milestone at this stage. So what I appeal to mothers and parents, by the way, both mothers and fathers. Fathers be so much interested because you are the ones who give money to mothers to go to attend antenatal. So I appeal to viewers, at least of our beloved TV, the family TV, to go and review all those recordings. And then if there is any problem, for example, in Mulago, Ward 15, that is where they examine babies who may have developmental issues. But also there are several associations. There is the Uganda National Association of Cerebral Palsy. I think they also have a number. We can share that number. Yes. 0702 66 2885 or 0772 0778 621 437. You can call such people and they guide you. You can also reach me, Dr. Hanifa Sengendo, on 0772 750 708 or 0701 750 708. As long as you give a password of Family TV, consultation will be free of charge.
Wow, thank you so much for the offer. But I think you repeat the Airtel number.
Okay.
Yes.
The Airtel number is 0701 750 708. Password Family TV. Yes. Then we shall talk free of charge.
We are grateful for the offer. So you know the password. Family TV, and then consultation is free of charge. We are grateful. Thank you so much, Doctor. And thank you so much for this time. I believe it has been a very beautiful interaction. Our parents out there, I believe you have learned a lot out of this. Yeah, Dr. Hanifa is still with us. She'll still be with us even next year. God will protect her for our sake.
For us, we say, Inshallah.
Amen.
Yes, so you say amen.
Amen.